Hello viewers, you're welcome to Excel Health Arena, and we've been talking about family planning, and probably this is going to be the last episode on family planning. But if you have any question whatsoever, you can be free to put your question in the comment section, and I will be readily available to give answers to your questions. Okay, so like I was talking about the side effects of male sterilization. I talked about testicular pain, scrotal pain. I talked about surgical site infection. Then other things I need to talk about is hematoma. There could be collection of blood in the operation site. There could also be sperm granuloma. So sperm granuloma is just like a form of lump, small lump that could occur around the area, swelling around the area of the operation. So those are complications that will arise from male sterilization. Now for the female sterilization, a woman that does not for any reason want to give birth to a child again, yes, is ready to take up female sterilization. We call it tubal ligation or tubal sterilization or tubectomy. So it is a widely uptaken procedure or method like that, and it's a permanent method like we said. And another thing I want to talk about it is if we want to group it or classify it, if we classify it according to timing, we will say that postpartum, sometimes when a woman gives birth, if a woman goes through cesarean section, before the cesarean section, the woman could have agreed or decided that she wants to have it done. So immediately the cesarean section is done, then they assess the tubes and they ligate the tubes. They ligate the tubes. It is either they tie and cut, they call it tie and cut. So when they tie the tube in between, they cut and separate. So once that happens, there is no link. It's just like they have cut a bridge. And as a result of that, there is no link between the uterus and the end of fallopian tubes where the egg is produced again, and so pregnancy cannot occur. So they can do that after delivery. They can do that after abortion, whether induced abortion or inevitable abortion, whatever type of abortion, it can be done if a woman wants to permanently put a stop to pregnancy. So another thing is that according to approach, they can do it abdominally, whereby incisions are made into the abdomen, they assess the tubes, they tie the tubes and cut the tubes. And at the same time, they can also do it like a mini insertion into the abdomen to assess the tubes and cut. They can also do what we call laparoscopy. Laparoscopy is they view it through some machines. They are able to see from the screen. They pass some tubes, some devices into it. Just creates a small incision past those devices like pipe into the woman's abdomen. They reach out for the fallopian tubes. They reach out for the tubes, and they are able to ligate the tubes, tie and cut. There is a way to do that without necessarily opening up the whole woman. Okay, and once that is done, they can be able to cut the tubes, ligate the tubes, and the woman is sterilized. So they can also cauterize. Cauterization means they are trying to burn, like they are burning after tying. They tie, yes, they now burn. When they burn, it doesn't allow any coming together of the tubes again, and as a result of that, there is no link, so the woman cannot get pregnant. So there are different ways of doing it. Most importantly, what we need to know is that the tubes are cut, tied and cut. The tubes are tied and cut, and as a result of that, there is no link between the uterus again and the fallopian tubes or the the fimbriated end, that is the finger-like end of the fallopian tube, where egg is stored and eventually released during ovulation. So the methods of blockage in this regard, there could be partial salpingectomy, that is partial cutting of the tube, of the fallopian tube. There could be clipping of the tube. They call it tubal clip. So there could be clipping of the tube. There could be tubal rings. They insert some rings. Rings in a situation like this will be tinier rings than the thickness or circumference of the tube, and so it tightens the tube in a way. You know, when something is tight, it cuts off blood supply, and as a result of that, that thing eventually dies off. The tissue there eventually dies off, and it just degenerates, and it's just absorbed, and that is just the end of it. So there could be fallopian rings or fallops rings. There could also be tubal rings. So either of the two, they are rings, and they are inserted to cause a form of strangulation, which eventually causes blood supply and causes a form of severing in between the tubes, and the tubes are separated. So fimbriectomy, the fimbriated end of the fallopian tube, like I said, is cut off, and sometimes there could be electrocoagulation. They just electrocute and just coagulate and freeze, or they cauterize by burning. And when this happens, all these things happen under anesthesia. So the woman will not feel pain ordinarily, but these things are achieved, and the tubes are cut, and there is no link between the tube and the uterus again, and the woman cannot get pregnant. So it's as simple as that, but as complex as that. So the laparoscopic one is simpler in nature, and it is also very effective, and it can be done under just, you know, a short period of time. They can just create 1 or 2 holes, tiny holes like that, you know, I said it, which they pass pipe through, and the pipe is able to reach out into the tubes to do the necessary things, and the sterilization is performed. So in a way, the woman is rendered sterile, and she cannot get pregnant. So now, if there are certain things I want to mention, you may want to delay tubal ligation. You may want to delay it to allow those things to pass, or work on those things before you go ahead with the sterilization. If there is pregnancy, if the woman is pregnant, you don't want to do it because she's already pregnant. If the woman is less than 6 weeks postpartum, apart from the fact that immediate postpartum period, it can be done just in surgery, it can be done quite all right. But if the woman is 6 weeks, less than 6 weeks postpartum, because of slight chances of pregnancy, you may not want to do it until you are sure that the uterus is healed up. The wound for cesarean section is healed up and all that, whatever. Or the woman has given birth, and then afterwards 6 weeks, you are sure that everything is okay before you go ahead and do it. Then if there is post-abortion, after abortion, you want to, if there is severe postpartum complications or post-abortion complication, you want to avoid doing it during that time. If there is unexplained vaginal bleeding, you don't want to do it. If there is pelvic inflammatory disease or sexually transmitted infections, you don't want to do it at that particular time. If there is pelvic malignancy, like tumor, cancer of the pelvis, of any part of the pelvis or the organ in the pelvic floor, you don't want to do it. So for those things, you want to avoid doing it. Then side effects, no known side effects as such, no known side effects. Now the benefits, it protects against unwanted pregnancy. You don't need anything to worry about. You don't need anything to remember about contraception. Oh, I don't want to get pregnant again. All those thoughts will not be there again. It prevents pelvic inflammatory disease. It may prevent ovarian cancer because the ovaries are removed. So hormonal, influence is much more reduced, and so chances of cancer is quite reduced. So Complications